The one thing your body relies on most to keep you healthy is your immune system. And when that isn't working as it should, it's a lot easier to get sick or even suffer from allergies. Today, we're looking into the root of this issue with Dr. David Houseworth from Ohio ENT and Allergy Physicians. Thanks for being here, doctor.
Thank you. Thank you for having me.
Now, from what I understand, it can happen to people all ages, all people really can have this happen to them, right?
Right. The immune system is functioning from birth, and it can have problems at any time. We see congenital defects, children that are born with problems in their immune system, and there are adults that develop problems in their immune system. They've been healthy their whole life, and then over time, their immune system starts functioning poorly and they develop infections and problems.
And what would be somebody's first clue if all of a sudden they're starting to develop an issue with their immune system?
The most common thing we see is recurrent infections. Lots of sinus infections. They go to the hospital with pneumonia, ear infections, infections that aren't typical for an adult or aren't typical for a child at that age. So it's the abnormal infection, what we look for.
And is it something that you have to get testing for, especially when it comes to an infection? Is it something you'll kind of be able to tell yourself, or?
Many people think what they have is just an infection, and where we step in is we are able to connect the dots, and we put the infection history together. And we look at a person and we say, you know what? You've gone from having 3 sinus infections over 10 years. Now you've had 10 in the last 2 years. Maybe something else is going on.
Okay, so this is also an important thing. I know that they test in Ohio, or they screen for immune deficiencies in newborns. So how does that make a difference?
In Ohio, we implemented a newborn screening program. And what that does, in the same way they look for genetic diseases and metabolic diseases, they actually look for immune cells, and they look to screen for children that don't have a functioning immune system, specifically severe combined immune deficiency, which is the boy in the bubble disease that many people have heard of. But they're looking to make sure that those children don't get that first infection, so they're screened at birth.
So they're screened at birth, and then is there a way to kind of then, be more apt to take care of them before they end up getting sick?
Those children that are screened at birth are actually then isolated to try and keep them from getting an infection so that treatment could then be put into place.
And how important in all of this is family history?
Family history is really important because many of the conditions are genetic, and especially in children. Immune deficiency in children is most often genetic. Not all of them. Many times there's a new mutation that comes into a family. But one of the first questions we ask is there a family history of people getting sick or of children getting sick?
Now, what type of therapies and treatments are available? Because we don't want our kid to be the boy in the bubble, right? I mean, and that's obviously an extreme. But what kind of treatments do you have today?
Well, so there are many. In that severe case of severe combined immune deficiency, bone marrow transplant is going to be the option of choice. You need to give that person a functioning immune system. But there are many less severe conditions. And one of the things we can do is what's called IVIG, or subcutaneous immunoglobulin. We take the proteins from plasma donors that are part of their immune system, and we concentrate them down, and people can get an infusion, often done at home, of those plasma proteins that help replace the immune system. People that it may not be as severe, we're more aggressive. We treat infections more quickly so they don't progress, so you don't go from a sinus infection to pneumonia. And it's all part of a continuum of how aggressive you have to be with your treatment.
And it's amazing how far things have come, and I imagine now they don't have as big of an impact really on patients' lifestyles.
The lifestyle for patients is almost the same as it would be if they didn't have an immune deficiency. With immunoglobulin replacement, we can do it once a week at home. They go to school normally, they have a normal job, they have normal activities, they travel. They can do anything they want to all the time being treated for immune deficiency.
All right, Dr. Houseworth, I want to thank you for being with me. Ohio ENT and Allergy Physicians, a great place for somebody to go get testing if they think they have an issue.
Thank you for having me. It was wonderful to be here.